Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for, and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you'd like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit, and don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. Today we'll be talking about diabetes and men's health. And in the usual fashion, I'm going to be joined by a colleague of mine. I'll allow him to introduce himself and tell you what his specialty is and what he does. So over to you.
Thank you, Dr. Kimbua. Good afternoon. Nice to join you here. I'm Dr. Arinze Chukwuebuniwe. I'm a urologist, and it's a field of surgery that cares for surgical disease of the urinary tract, men's sexual and reproductive health, and andrological diseases in general. Nice to join you on this and to have this discussion. It's a privilege.
Thank you. You mentioned three things. When you first said surgical diseases of the urinary tract, I was a bit apprehensive, but then you clarified it. You said men's reproductive health, which is actually what we're discussing. And then you said androgenic disorders.
I mentioned
what yes, what does that mean?
Generally, that means is our own medical term to coin a lot of diseases and conditions and all that pertain to the male reproductive organ or system and the way they are handled, the way they are treated, the diseases that affect them. It's just a broad term, yes.
Okay, thank you. So I'm happy that we are on the right track. We are on the same page. So let's start right away. What does it take for a man to be able to impregnate a woman? Because to have children, for a woman to get pregnant, she needs to be impregnated by him. What does a man need to have? What are the requirements for a healthy man to impregnate a woman?
Well, for pregnancy to ensue between a couple, there is need for there to be a viable sperm, which contains viable sperm cells, which will meet the ova, which is the egg in the female partner, for there to be fertilization. And once fertilization has occurred, there is also a development of an embryo that will develop eventually to a baby, which the woman carries in the womb, the uterus, until it's time for delivery. So for there to be pregnancy, there needs to be that meeting point between the sperm and the egg to achieve fertilization, and that will then go on to the viable zygote and development of a viable offspring within the uterus.
Thank you for that. So where are sperm produced?
Sperm are produced within the testes. They are produced within the testes in the male. And it's a complex mechanism. That process actually starts from puberty for the male. There are different levels. It starts from puberty at the point of maturation. So puberty is what signals it to begin to mature. Before then, they are more like undifferentiated cells that have developed and stopped at a point. At puberty, they are now set forth to begin to be active. Puberty is when the male subject, when the male child or the male begins to be sexually mature. It's a special period that leads to elaboration of hormones and all that, with the development of secondary sexual characteristics, the masculine body, enlargement of the penis and the testes, special development of hair in special areas, and then the desire for sex and all that. So all that mechanism triggers that development to go on in course, and sperm begins to be produced. And so sperm is primarily produced within the testes of the male. So, and is being stored and ejaculated at intercourse. Ejaculation simply means the proportion of the sperm from within the reproductive tract into the genital tract of the female partner. And from there, the sperm will go by swimming actions to meet the egg within the fallopian tube of the female partner, and fertilization occurs. So in a clear, simple summary, that's basically what is needed for there to be fertilization and pregnancy.
All right. So at what age does puberty usually take place?
It's not fixed. It depends on several factors. It depends on race. It depends on genes and all that. But typically in our environment, boys approach puberty 10, 11, 12, 13, thereabouts. And for the ladies, menarche, almost about the same time. But for some people, it may come quite early. And at that point, be noted if is it a disorder or it's just part of the genetic makeup of that individual. Yes.
Okay. So can diabetes affect this process? Can diabetes affect the process of sperm production, the process of reproduction? Can it affect men's reproductive health?
Diabetes can affect reproductive health in varied ways. The truth about diabetes mellitus is that it affects every organ system of the body in different degrees. So the genital system is not really left out. Okay. Even the urinary system is not left out. But they are related. Many times it's difficult to mention one without mentioning the other. But that's not exactly what we're discussing this afternoon. Yes. So it affects every organ system, but it does not generally affect the cellular system that subserves for sperm production.
Okay.
Does not, yes, it does not specifically, because those are, um, when I mean affecting specifically, if there are many issues that border around fertility, but diabetes in itself does not really have a direct relationship to either increase sperm production, reduce, or stop, as much as knowledge as at now can find. Knowledge evolves every day as we
Yeah.
speak. Some research may have gone in that have brought this to the fore, but generally it doesn't affect sperm production. Where the problem comes in is in the processes of sex and intercourse,
Okay.
which from the natural um, from every natural process is needed for sexuality and reproduction. That's where it affects in regards to issues of erection, particularly penile erection for the male partner. Yes, so generally that's the way it goes.
Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. From what you've said, diabetes doesn't affect sperm production,
It
but
doesn't directly affect spermatogenesis.
yes, but
Yes,
it causes erectile dysfunction in men.
yes,
Okay.
it does.
So what can men with diabetes do to preserve their to I don't want to say treat now, but how can they handle diabetes so that they don't get erectile problems, or if they have what can they do to reduce or stop it?
Now, for an individual who is diabetic, or an individual who probably does not know and it's just about being evaluated to be diagnosed, what is general advice is to first of all understand education has a lot to do. First of all, understand what is this health condition you are dealing with. Is grouped as what we call the what I don't know if family physicians still use that terminology. Will I say non-communicable diseases? I don't know if they still
Yes,
use that terminology.
yes, yes.
Yes, we in surgery call them chronic medical disorders.
Okay, we use that
Yes,
as well.
yes, we call them chronic medical disorders because they are medical. They are mainly treated by um, medical means, except when complications arise, surgery comes in. So these disorders are things that border on several factors. The causes are not exactly known, but there are associations. So, and for the fact that it's said to be chronic means that it tends it's not like something you treat and it goes. The individual more or less lives with it. So it's important that the individual understands this so that you know that, okay, the evaluation and treatment you are going on for today is not just for today. So I've taken my medications for today, therefore that's it. It's a continuous thing. So it needs continuous evaluation, continuous treatments. Treatment may vary as time goes, it may modify and all that. So if you understand that, you will be able to appreciate what you are dealing with so that you can follow through with treatments. So compliance with treatments and follow-up is very important. With the endocrinologists, with the physician, it's important for the diabetic man to understand it so that he will have good blood sugar control on the whole. Yes. For sexual issues, blood sugar control is not just for a particular day. It's important that it's controlled for most of the time. Most of the time. For every day you have good blood sugar control, it's a plus. But what is advised is the cumulative effect, such that so that the damage it causes in the body is minimized as much as possible, as against just isolated checks and all that. So it's more like it's a long-term thing. It's not a daily affair.
Okay, so if I hear you correctly, it's not only when the couple wants to have intercourse that the blood sugar should be controlled. It should be all as much as possible all the time to prevent whatever damage will
Yes,
cause.
to prevent, to prevent damage. We call those damages complications. Complications, and those complications occur in every part of the body, including the genital tract. It's those damages are found over time. Yes, so it's important that control is maintained so as to be on the winning side, to have less risk and less chance of complications. Yes.
Okay, so what can spouses, family members, and partners do to help with this issue?
A lot. They can do a lot. Life is merrier when you have company.
I like
Yes.
that.
When you have company, as in worthy company that believes in you, that understands you, and have your interests, your best interests at heart. So for the spouse, the wife, or partner to whatever extent, family members, brothers, relatives, they have some role to play by encouraging the subject to follow up. The individual has to, first of all, like I said, understand the challenge he's facing and comply with treatment, comply with follow-up, comply with advice. If you're on dietary control, you comply. If you're on medications and all that, then the partners also see to it. It's not easy being on medications. That's one issue, yes, and all that. But they will be able to encourage them, make them see the brighter side, and give that moral and psychological support that is needed. And where the partner falls short, you realize that your partner has this challenge. It's not that the person is not willing, or it's not of the person's making, and you try to make the most out of it to reduce the tension within the relationship and all that, because that's an ever-present problem. Many times when you find men coming with erectile issues to see the urologist, is not necessarily because they really want, yes, they want it resolved, but many a times it's because of the tension it may have built in their relationship and the push to get evaluation and treatment. Yes. So the partners, the relatives, the spouse will have a long way. And if it's for the dietary control, the physicians will say a lot on that. They will give a guide and all that. Before now, it's been said that there are certain foods you shouldn't eat, this, that, and that. They have to strictly remain to beans or this or that. But as research and practice have evolved, we have been made to understand that it's more about the quality and the quantity of what you take than about
Exactly.
the exact meal. So you still be able to have a nice meal, but you portion it. The dietitian will be able to portion what you should take and how you should take, and the ones you should minimize, so that life is easy and all that, and compliance is easier. So, for example, the wife may be able to help with that, and the partner. And for those that are elderly, those that are taking care of them and all that, and minimize further harmful things and all that, that's consuming raw sugar, beverages that have it all raw and all that. So they have a role to play in that. Yeah.
Thanks a lot. So, wives and partners, we need to reduce tension, as Dr. Arinze said, and make things light and pleasurable in the home. So, what is the role of supplements and aphrodisiacs in erectile dysfunctions for diabetic patients? Are they beneficial? Are they harmful? Should people use them? What's your take?
Well, a lot of products are out there in the market. and a lot of herbs and what some of our people call abo. So there are all manner, a lot of things that are there. And so many things are touted. These days, you see a lot of links, what to do, not to be a 1 minute man, all that. Do this and you go from 0 to 30.
How to enlarge
our,
the penis.
our society is being bombarded with a lot of information, and many are not exactly true. If the male partner, if the man has found out that he has erectile issues and is also diabetic, it's first of all, what we advise is for him to seek help, see a physician, receive counseling, first of all. Not every erectile dysfunction is necessarily due to organic damage. Yes, even in diabetics, the whole of their erectile issues may not all be due to the complications coming from diabetes. There is still a psychological part, a lot, yes. So before you go seeking so many medications, human beings generally have a tendency for self-help. And being that sexual issues are very private, you would rather try to solve it yourself than open up to someone. Yeah. So, but I want to be like a light of encouragement. It's quite common, more common than is acknowledged. Yes. So, first of all, before you go for all those supplements, seek help. See the physician, see a urologist, get evaluated so that we see where are the problems. Some people say, but my sugar is even okay, but I'm experiencing this. That's the more reason why you should come around so that you can be examined, evaluated, and properly investigated to know where the problems are. Yes. So that being said, supplements and all that are there, a lot of things are claimed, and we need to sound a note of caution. Some may be harmful, some may give exaggerated effects, okay? And yeah, we don't really like to say, this thing is not helpful, drop it, abandon it. When you come to us, we tell you that, well, I've heard you, I've seen what you brought, but we don't have the evidence level to prescribe or recommend this for you. Science is a very practical field of life. So we as scientists and as surgeons, that's the advice we give. They may be helpful. We will not tell you outrightly that they are not. But rather than going all the way taking them, why don't we evaluate and see what the problem is? If we address the cause, you find out that things may begin to resolve on its own or even improve, rather than going for supplements and all that and aphrodisiacs. There are a lot of products. One needs to be careful. And at the other extreme of it, some of them predisposed to priapism.
Wow, what's
Yes.
that?
Priapism is more like an it's more, if I will use the word, more like an exaggerated erection. In this case, erection actually ensues, but it now persists even beyond the desire for sex, beyond the intent for sex, and even after the sexual drive is gone, it persists, and the individual does not detummis. The penis does not go back to baseline. Yes, and the danger in that is that the blood there gets accumulated, becomes low in oxygen and nutrients, and rather becomes high in metabolic wastes and destroys the tissues there. So in solving one problem, another is created. Yes, and that in itself is another very persistent and debilitating cause of erectile dysfunction.
Oh, wow.
Yes. So we don't just recommend going on supplements. Well, you may take them. They may be helpful. Some of them contain vitamins and this and that, but we advise a note of caution just depending on them. And when we talk about supplements, a supplement is not supposed to take the place of the medications of a patient, no matter how it's touted. many of these products are brought for mainly financial reasons, economic reasons, rather than being health, rather than being like a health advocacy and all that. So that's the challenge. That's a challenge. Some of them are just for that. So we like to be practical in that regard. It's important that one should be cautious with that. And when you say you are supplementing, if you say you are supplementing, that means something is deficient. So what are you saying is deficient that you are supplementing? Many of the things of those things you are supplementing in a very good balanced diet, they are obtainable in adequate quantity. So are you supplementing what you're already getting in your diet? Yes. So that's it.
All right. So do diabetic medications affect erection?
Diabetic medications, what they do primarily is to lower or normalize, regulate blood sugar. And in that way, they improve the general health state of that subject. Yes, and try to minimize and mitigate the damage caused by diabetes. Okay? Yes, they are not so prominent in causing erectile dysfunction, but there are some other medications that are implicated, which diabetics may also take. There are hypertensive medications, there are blood pressure medications, there are anti-lipidemic medications that have been seen, noted to reduce, yes, the potency of erection. But that should not make the subject not take them, but they should be under strict physician instruction. That's why you should be seeing a physician. And in a similar way, this is the drug my brother is using. I'm also using it. So people share medications. And that's what we see in our environment, in our society. Instead of, you go to a pharmacy, you go to a chemist shop, they say, I have sugar. And the man there writes drugs and gives you. If you have a health condition, you shouldn't be going to the chemist, to the pharmacy. You should be seeing a doctor. You should be seeing a doctor who will guide you. And there are several specialties in medicine that you can be referred to for every condition that you face, and you'll be properly advised. Yes, some medications may reduce the potency of erection, but with the guidance of a physician, you'll be guided on how to use them and how to mitigate them. And if they could not be substituted, then it may be used, it may be managed in conjunction with urologists to guide you on how to handle the erectile issues that have developed. But it's important for diabetics to remain on anti-diabetic medications. The problem in diabetes are what we call complications happening within the blood vessels. We talk about microangiopathies. What that means is complications happening in the tiny blood vessels. Then we talk about macroangiopathies, complications happening in the larger blood vessels, the blood vessels that you can see. So what diabetes does is to cause changes in the lining of these blood vessels over time. Changes in their lining, in the way they are elastic, in the way they expand, and all that. And on the other hand, it causes changes in the nerves. Erection is a complex mechanism that involves the nervous system and the vascular system. So the impulses come all the way from the brain, and there are fine nerves that go all the way to the penis. It's a whole cascade of the system. It's not just at a point. So with these high levels of blood sugar, all these structures are damaged slowly over time. The nerves become less responsive, they fire at slower rates and all that. So that's why he said that diabetes affects every system in the body. And coming to the penis now, the penis is a whole, the erectile tissue of the penis there are blood channels. Blood comes into the penis holds it within, erection ensues. And when intercourse has gone on and the individual is satisfied with ejaculation, there are signals that signal for the blood vessels that have been closed up to be open so that blood flows back into the system. It's more complex than I've said, but for understanding's sake, that's like the basics. Yes, so those blood vessels, those blood channels that are in the penis are destroyed
in
in
diabetes.
diabetes. They are damaged so that they are less responsive. Yes, they are less responsive, and that's why the individual over time finds out that his erection is affected. Say some say the erection is not even able to penetrate. So that's basically what happens. So with a controlled blood sugar, the incidence of these changes within the penis, within the nervous system, is mitigated as much as possible. Yes.
All right, thank you so much. So, what can patients do to help you give them the best care?
What they can do, like I said, is for them to come for evaluation. We're in a society where coming to the hospital is like a taboo. It's until the patient is completely grounded before we come. Yes, we see it as if it's a thing of bad luck to be in the hospital. I know that say, where are you? I went to the hospital. What happened to you? I know that it's not my portion and all that, but it's not really so. It's not really so. Your physicians are your partners in progress. Your doctors and other health workers who work with them, the nurses, the pharmacists and all that, they are your partners in progress. They are there for you by training and by profession. They have put themselves there so that they can serve society in that regard. So it's important that you should come to see your endocrinologist and see your urologist if these erectile issues have come forth. Like I mentioned earlier, that diabetes is not the only cause of erectile dysfunction. There are several other causes. For some men, it's even the onset of erectile dysfunction that led to them discovering that they have serious medical complications from other things, including heart disease. Yes. So it's important to come around so that you can be guided, you can be evaluated, tests done for you, counseling done, so that the problems to be identified and to know how to start to treat. Yes. Instead of just going looking for drugs. You may eventually go on those drugs, but it's important to have proper evaluation and treatment.
So it's better to know what the problem is.
Yes, it's better.
That's half. There's this saying that a problem known is half of the solution.
Yes.
So when you know what the problem is, then you know how to go on from there. And
how to go about it. The problem is said to be half solved.
Yes.
When you have, yes.
So it's also important to note that diabetes is not the only cause of erectile dysfunction in men with diabetes. Yeah.
It's
so,
not.
Okay. Good. Thank you so much. The last question, what advice do you have for any man with diabetes before we round up?
Okay. Our men with diabetes, we want to encourage you. It's not a death sentence. It's not it's like we said earlier, it's a chronic medical disorder. But that's what it is. One can still live close to normal life when it is controlled. Yes. So what's advisable is to seek help early and to comply. We can't overestimate overemphasize rather the importance of that. A lot of things are on the internet now. We are in an information age. A lot of things are being said. If you boil this leaf, if you drink it, it does this. If you do that, it does this. Like I said, there is not much evidence on that. If we are going to live by facts and work with evidence, we should do what has been proven. Yes. and all that. So we want to encourage you that there's help, there are evaluation and there's treatment, and they are effective. They are effective, and when you have on evaluation and treatments, control it could be achieved and minimize the complications that will ensue. Not just erectile problems, there are all manner of complications that can ensue from diabetes. Then it's important to have regular reviews. I, for one, I encourage my diabetic patients to have their own glucometer, just to encourage them for them to know how they are doing. Not to say that when you measure you are doing well, you just stay. When you have control, the reviews may not be as frequent as when the control is in there, but it's important to be guided. Yes, it's quite important. Yes. Having groups and bodies of people with similar challenges is encouraged these days. Having like a diabetes group, diabetes association, and all that, share information. Yes, that may help with being encouraged, being guided, but ultimately, you stand a lot to benefit when you discuss with your physician and it puts you through.
Thank you so much, Dr. Arinze. So you've heard it all. Your physician, your doctors, your nurses, your pharmacists are your friends and your partners. Diabetes is not the only cause of erectile problems or reproductive health problems in men with diabetes, and it is not a death sentence. If the problem is identified and addressed early, it's easier to solve. I hope you've learned a lot. I have learned a lot, and we'll see you on the next, when we are discussing the next topic. Thank you very much. I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos because there's still lots of information that will be really beneficial to you. Don't forget soil.web.app. Download it now. See you in the next video. Bye.